Jackie here from the Kidneys of Physiology, filtering out the stuff that you need to know and what you don't need to know about exercise physiology. Hi everyone. So today we're actually going to talk about the anatomy of the heart. So as I go through, we'll go through some anatomy and then also about the path of blood through the heart. So let's start off with some simple anatomy stuff. Right here, what I've got is a very anatomical heart, sense the sarcasm. So we've got a heart here, we've got some lungs, and then I've got systemic circulation over here, so the body, all right, pictured by my cute little guy over here. All right, so first let's start off at the right side of the heart. So when we're looking at the heart, when we are looking at the heart straight on, our left is going to be the heart's right. All right, so first and foremost, let's start off here at the right atria. Okay, RA, right atria. Now, the path of blood, if we're starting in the right atria, is actually going to move through what we call the tricuspid valve and into the right ventricle. Okay, so right atria through the tricuspid valve into the right ventricle. So starting there. From the right ventricle, we're going to move what we call the pulmonic semilunar valve. Okay, and from there, the blood will be ejected when the heart contracts. From the right ventricle, the blood will move through the pulmonic semilunar valve out into the pulmonic arteries, the pulmonary arteries. Okay, and now what's going to happen is, as you could guess, pulmonary, we're going to move into the lungs from that area. So from the pulmonic arteries, we are going to have a path of blood, mind you, deoxygenated blood, which we'll get to in another video, is going to move from the pulmonary arteries into the lungs. Okay? At the lungs is where it's going to be oxygenated, right? It's going to pick up oxygen, drop off CO2, and that exchange allows us to now have oxygenated blood, which can leave the lungs through the pulmonary veins. Okay, so it leaves the lungs oxygenated through the pulmonary veins and into, what do we think this is? Another atria. It is the left atria. From the left atria, it's going to move through another valve called the bicuspid valve. Okay. When it moves through the bicuspid valve, we then enter the left ventricle. And from the left ventricle, we are going to move through another valve right here called the aortic semilunar valve. All right. Entering what we know as the aorta. So here's our path again. We're going to move from the left atria through the bicuspid valve into the left ventricle, out through the aortic semilunar valve, which will bring us out into the aorta. All right? And from the aorta, that oxygenated blood is going to go through an extensive capillary network to feed all of the tissues of the body oxygenated blood. So we make our way through all this extensive capillary network and we can feed the tissues of the body. Now, what happens after that blood has been deoxygenated by the tissues? So oxygen has been dropped off at all of our tissues, right? And we pick up CO2. And now we have this deoxygenated blood, which I'm going to represent with blue again. So now we have a deoxygenated blood moving through the system, okay, through the veins, back up to the heart, where we get back to our starting point at the right atria. So blood that's leaving the systemic circulation through all of our veins is actually going to make its way up through and down through. Blood making its way up through the inferior vena cava and the superior vena cava are going to then allow us to bring blood into the right atria. Again, deoxygenated blood in the right atria, starting our whole system over again. So let's do one more quick recap right through the heart. So, deoxygenated blood coming from systemic circulation that has just dropped off oxygen at all of our tissues is entering through the inferior and the superior vena cava into the right atria. From the right atria, that blood is going to move through the tricuspid valve to enter the right ventricle. After the right ventricle, it's going to make its way through the pulmonary semilunar valve into the pulmonic arteries. The pulmonary arteries are going to lead us to the lungs, where we're now going to oxygenate that blood. We're going to drop off CO2, and we are going to pick up oxygen at the lung. Now we have oxygenated blood moving from the lungs through the pulmonary veins into the left atria. From the left atria, moving through that bicuspid valve into the left ventricle, where when the heart is contracted in a cardiac cycle, it is going to eject blood through the aortic semilunar valve into the aorta and through systemic circulation, bringing us back to the body and its tissues. Have a great day.